Endoscopic retrograde cholangiopancreatography, Wikipedia audio. Endoscopic retrograde cholangiopancreatography is a technique that combines the use of endoscopy and fluoroscopy to diagnose and treat certain problems of the biliary or pancreatic ductal systems. Through the endoscope, the physician can see the inside of the stomach and duodenum, and inject a contrast medium into the ducts in the biliary tree and pancreas so they can be seen on radiographs. ERCP is used primarily to diagnose and treat conditions of the bile ducts and main pancreatic duct, including gallstones, inflammatory strictures, leaks, and cancer. ERCP can be performed for diagnostic and therapeutic reasons, although the development of safer and relatively non-invasive investigations such as magnetic resonance cholangiopancreatography and endoscopic ultrasound has meant that ERCP is now rarely performed without therapeutic intent. The following represent indications for ERCP, particularly if or when less invasive options are not adequate or definitive. Medical uses. ERCP may be indicated in the above diagnostic scenarios when any of the following are needed. The patient is sedated or anesthetized. Then a flexible camera is inserted through the mouth, down the esophagus, into the stomach, through the pylorus into the duodenum where the ampulla of Fata exists. The sphincter of Oddi is a muscular valve that controls the opening to the ampulla. The region can be directly visualized with the endoscopic camera while various procedures are performed. A plastic catheter or cannula is inserted through the ampulla, and radiocontrast is injected into the bile ducts and/or pancreatic duct. Fluoroscopy is used to look for blockages, or other lesions such as stones. Endoscopic sphincterotomy, removal of stones or other biliary debris, insertion of bile duct stent, dilation of strictures. When needed, the opening to the ampulla can be enlarged by a cut with an electrified wire called sphincterodome and access into the bile duct obtained so that gallstones may be removed or other therapy performed. Other procedures associated with ERCP include the trawling of the common bile duct with a basket or balloon to remove gallstones and the insertion of a plastic stent to assist the drainage of bile. Also, the pancreatic duct can be cannulated and stents be inserted. The pancreatic duct requires visualization in cases of pancreatitis. In specific cases, other specialized or ancillary endoscopes may be used for ERCP. These include mother-daughter and spyglass cholangioscopes as well as balloon enteroscopes. The major risk of an ERCP is the development of pancreatitis, which can occur in up to 5% of all procedures. This may be self-limited and mild, but may require hospitalization, and rarely has the potential to become life-threatening. Those at additional risk for pancreatitis are younger patients, females, patients with previous post-ERCP pancreatitis, procedures that involve cannulation or injection of the pancreatic duct, and patients with sphincter of Oddi dysfunction. Intestinal perforation is a risk of any gastroenterologic endoscopic procedure, and is an additional risk if a sphincterotomy is performed. As the second part of the duodenum is anatomically in a retroperitoneal location, perforations due to sphincterotomies are retroperitoneal. Sphincterotomy is also associated with a risk of bleeding. There is also a risk associated with the contrast dye in patients who are allergic to compounds containing iodine. Oversedation can result in dangerously low blood pressure, respiratory depression, nausea, and vomiting. Other complications may include heart and lung problems, infection in the bile duct called cholangitis. In rare cases, ERCP can cause fatal complications. Cases of hospital-acquired infections with carbapenem-resistant Enterobacteriaceae linked to incompletely disinfected duodenoscopes have occurred in the U.S. since at least 2009 per the FDA. Outbreaks were reported from Virginia Mason Hospital in Seattle in 2013, UCLA Health System Los Angeles in 2015, Chicago and Pittsburgh. The FDA issued a safety communication design of ERCP duodenoscopes may impede effective cleaning in February 2015, which was updated in December 2015. Diagnostic, therapeutic, contraindications, procedure, risks.